A very warm good afternoon to everyone. Myself, Dr. Pragati. I am professor in Department of Prosthodontics, Crown and Bridge, Mahatma Gandhi Dental College and Hospital. Today we will be discussing about centric jaw relation. Centric jaw relation is one of the most important jaw relations that we have, and let me tell you that it is in sequential to what we just did before centric, that is the vertical dimensions. After we have established the vertical dimensions, we move to the next concept of understanding what is this centric jaw relation. The term itself has three parts, there is a centric, there is a jaw, and then there is a relation. And I'm just trying to draw your attention to it because all these three terms will fall together in the definition. So let's proceed to understand this very, very important part of jaw relation records. Now, it is a part of horizontal jaw relations. If you remember in your previous lectures, we have understood that there is a vertical jaw relations, orientation jaw relations, and horizontal jaw relations. Amongst horizontal, today we are discussing centric jaw relation. So let me just go through the definition of what exists in our literature. Once you have established the correct vertical dimension, now is the step to determine the jaw relation in the horizontal plane, and that is what we understand as the horizontal jaw relations. In this, we have two parts. You have centric and we have eccentric. So today we will be discussing centric relations, which is a part of horizontal jaw relations. The definition has changed over the years. We have so many types of definitions over the years, and we will just revise one basic definition of previous literature followed by the updated definition of centric relation. So let me just tell you what was used previously. It is the most retruded position of the mandible to the maxilla. So most retruded means the one which is right behind, as far as posterior as possible. So most retruded position of the mandible to the maxilla when the condyles are in their most posterior unstrained positions, when the condyles have no strain and the ligaments muscles are not stretched in the glenoid fossa at a established vertical dimension. This definition tells us the significance of recording the correct vertical dimension before we proceed towards recording the centric relation. But this definition was further modified over the years. This definition firstly has been taken from the glossary of prosthodontic terms, which was further modified over the years. Today we speak about it as being the maxillomandibular relationship, because it is a jaw relation of the maxillary jaw to the mandibular jaw. Therefore, it says maxillomandibular relationship, in which the condyles are articulating with the thinnest avascular portion. So firstly, the condyles are articulating means they are meeting the thinnest avascular portion. So if you remember the anatomy of the articular disc, the central portion of the articular disc is absolutely thin and it is avascular. It is there that the patient will have no pain if the condyles were to articulate. Therefore, it says condyles articulate with the thinnest avascular portion of their respective disc, means the right side will go to the right and the left will go to the left. With the complex means the articular disc as well as the condyle, the complex in the antero-superior position, placed against what? Against the shape of the articular eminences. This position is independent of tooth contact. This point is very important, that this is a jaw-to-jaw relation where the teeth are not present. As it is, we are talking about edentulous patients. So right now we are concerned about the jaw and the jaw. So the teeth do not determine this particular relationship. This position is clinically discernible, means you can make this out clinically, it is seen, or you can visualize this when the mandible goes posterior and anteriorly. It is restricted to purely rotatory movement around the transverse horizontal axis. So this transverse horizontal axis is that imaginary line which is passing through both the condyles, and if your jaw has gone into centric relation, it is here that the jaw is going to do a pure rotatory motion, and it is not dependent on what teeth lie in between which maxilla and the mandibular jaws. This is what this definition implies, and it's a definition to be just understood. Once we have understood this, let us understand what are the features and therefore significance of centric relation. It is first and foremost arch to arch, like we said in the definition, maxillomandibular relationship. So it is arch to arch relationship, hence optimum position of the jaws for the health, comfort and function. So this health and comfort of function of the temporomandibular joint comes because the condyle is articulating in its in the thinnest avascular portion, and the muscles are in their correct vertical dimension. Therefore, the patient is going to be comfortable, and this position will enhance the health, overall health of the patient. It is the mandibular position where the condyle discs assembly is seated, braced in the antero-superior position. This we have seen in the definition. So the condyle disc, the condyle along with its disc, this entire assembly is falling antero-superior position against the slopes of the articular eminences. Although it is believed to be the RUM position, RUM is the short form for rearmost, uppermost, midmost position within the glenoid fossa. So this is the anatomic understanding of the centric relation, what is happening to the condyle, where is the condyle positioned along with the articular disc when the relation is in centric relation. Then we also have understood in the definition that it is here that the jaw is going to do a pure rotatory motion. So therefore, it is a relation where there is the terminal hinge axis passing through and the jaw is performing a pure rotatory motion. In centric relation, it is therefore going a pure rotatory motion without moving forward or translation. It is also a reproducible, repeatable position, and therefore we use it in our clinics to record it easily. It is repeatable. That means if the patient is not strained and I am able to manipulate the mandible, or the patient is able to go into centric relation, he can go into the exact same position multiple number of times. Alternatively, if along with me some other clinician also tries to manipulate the patient the jaw to bring it into centric relation, it will go into exactly the same position. Therefore, it is a reproducible position. You can arrive at it repeatedly provided all other factors remain the same, and thus serves as a reliable guide to develop the centric occlusion in artificial dentures. We use this particular property because it is repeatable, because it is reproducible. We use this property to develop occlusion in centric relation. We will try and understand this into greater detail in the future slides. It is the starting point of arrangement of artificial teeth. Since the artificial teeth are being arranged for a edentulous patient, we need to have some starting point. And why centric? Because centric is the point where the patient is going comfortable and healthy. It is the point where I can repeat and record. It is the point which is the anatomically most favorable point for the patient to be comfortable. So keeping that in mind, we start using centric relation as the starting point. Not only that, centric relation is the point starting and the end point of all mandibular movements. So if the patient is going to translate, he will come back to centric. If he is going to go sidewise, then he is going to come back to centric, and therefore it is logical and scientifically correct to use centric as the starting point to arrange the teeth. It also serves as a reference position for the rehabilitation in the dentulous conditions. This is in continuation with the previous point. The terminal act of the masticatory stokes ends at the centric relation. It is also the position where the upper and the lower teeth come in direct contact while you are swallowing or during deglutation. Centric relation is a reproducible and also a stable position. It is stable because it will, once you have given the right conditions to the patient, the centric relation does not change. So therefore, it is a stable position. We have already seen how centric is a reproducible position and a repeatable position. Therefore, it is used as a reference position when you start arranging the teeth and mounting the cast. So when I say we mount the cast, in which relation we have mounted the cast? We have mounted the cast firstly at the correct vertical dimension, and then we have mounted the cast in the centric relation. for the purpose of developing the occlusion. So therefore, logically speaking, if you hear what I said previously, all these 5 points were spoken how in some form or the other, and we call that as 5 R's. The 5 R's stand for recordable. That means centric relation actually can be recorded. It can be taken out from the mouth of the patient and put on an articulator. Therefore, it is a recordable relationship. Also, it is reproducible. I have already said I can take it multiple numbers of time, patient can give it also multiple numbers of time. So, it is a reproducible position. It is also the most retruded position of the condyle, as the definition spoke. It is a reference point for developing the occlusion. So, that is the starting point from where I start developing the occlusion, either in centric or also in eccentric. Therefore, it is said to be a reference position. And of course, it is providing a relation of not only the upper jaw to the lower jaw, it is providing the relation of occlusion also once the teeth are arranged in centric as well as in eccentric positions. Eccentric means any position other than centric is called as a eccentric position. So, let us come to more complicated concept of centric occlusion. So, here the first term is same, centric means center point, but the second term is different. So, we had studied centric relation in the previous term, but now we are studying centric occlusion. So, occlusion simply means when the upper teeth come in contact with the lower teeth, that is called as occlusion. When I combine the term centric along with occlusion, it means when the upper and the lower teeth come in contact in which jaw relation? In centric jaw relation. So, the definition says the occlusion of the opposing teeth when the mandible is in centric relation will be called as centric occlusion. This may or may not coincide with MIP, that is maximal intercuspal position. Generally, the maximal intercuspal position lies slightly anterior to the most retruded position. So, since the most retruded position is centric relation, whatever occlusion is developed in that relation is called as centric occlusion, whereas it is slightly more retruded or may not coincide with the maximum intercuspal position found in the dentulous patients. In edentulous, we ensure that the maximum intercuspal position is coinciding with the centric occlusion, but it is in the dentulous patients that it may not coincide. Let us move ahead. Let us see how we can record the centric relation. We have already said that it is a recordable position. That means, if it is there in the patient's mouth, I can record it and bring it on my articulator. So, what are the methods by which I can do this? Since it is such an important relation, there are multiple methods by which you can record the centric relation depending on your expertise, on the material available, and how exacting you require your centric relation to exist. For example, functional chewing methods were used initially, where functions was used to record the centric relation. It was then further on modified and worked upon with the graphical methods of recording centric relation. And then you have a static method, that is the intraocclusal check record methods. Each one of them works on a different concept, and different materials are used for recording because the concept is different. So, if you understand the concept, you will understand the choice of material or the technique which is used for recording that particular technique. So, when I say functional, it means that the patient is under some kind of, or the jaws are performing some function while the record of centric relation is taking place. So, in this method, the patient produces a movement by how? By protrusion, retrusion, or slight movements. So, you have needle house technique, and in needle house technique they used 4 metal styli in the maxillary rim. So, 4 metal styli were placed in the maxillary rim, and then the patient is asked to do a mandibular movement where they make the indentation for the centric relation, and you get this, because of the styli you will get some kind of a shape of tracing on the wax rim of the mandible. and that gives you the idea of the centric relation record. The Patterson's method used again wax rims, but along with wax rims it had the use of half plaster and half carborundum placed when you made a kind of a trench, small block, and place this intraocclusal recording material. Again, ask the patient to do mandibular movements, and with that mandibular movements you would get that curve onto the plaster, and this would get reduced to and shape and record the centric relation. But the more accurate method of recording centric is the use of graphical methods. The graphical methods are also require greater expertise from the clinician as well as from the patient. So it is divided into two basic parts. When I say graphical, it means also Gothic arch tracing. The term Gothic comes from the type of arrow which is obtained because of this record, and it is divided into two basic concepts, that is extraoral graphic recording and intraoral graphic recording. The name is very clear in itself. When I say extraoral, it means outside the mouth. When we say intraoral, it means inside the mouth. So we will just see how this particular method was used. So today we will just cover the intraoral record. See, here the record is placed within the oral cavity. The tracers are placed within the oral cavity. The tracer is the device which is used to record the centric relation in the graphical method, and in case of the extraoral it goes outside the mouth, whereas in case of intraoral it goes inside the mouth. So here you can see that this is placed inside the rim, so it is placed inside the mouth. This is the stali which will maintain the vertical dimension, and you can see that there is a plate over here. The plate is the one on which the stali will touch, and when the patient does the movement it will scrape and give you the Gothic tracing. So this is a rather accurate Gothic tracing when the patient does a protrusive record and then does latrusive record. So here the patient is asked to move forward, backward, rightwise, leftwise, and you will be able to get one point where all these records come in contact. If there are, you have other types also of tracings that are obtained which are blunt, and here the latrusive is not there, protrusive is not in one straight curve. These are all erroneous methods of recording. But what you must see here is that this is the intraoral method of recording. Here you can see that there is the Gothic tracing which has been obtained similar to this one. Again, this can be said to be erroneous because the patient gave a reading slightly beyond what was required, but on multiple training the patient would be able to give you the correct form of tracing. So with this we end the intraoral tracing and we end today's session.